2 new Pfizer and Moderna vaccines will become available in Australia soon as COVID cases rise in the lead up to the festive season. So we've got this 8th wave that's taking place at the moment. But concerning new data has revealed just 1.9 million Australian adults have received a jab in the past 6 months. So it would seem that people are off it. Joining us live now is the infectious diseases expert and the physician, Robert Booy. Robert, it is good to talk to you as always. A lot of my mates are coming down with COVID at the moment, so I wanted to get you on to talk about it. We're in the midst of this 8th wave at the moment, so how serious is this wave and the current COVID strain?
Yeah, well, the latest wave is yet another subvariant of Omicron. We've had countless waves of Omicron over the last 2 years, so at least it's not a new variant, it's just a subvariant. And the peak is likely to be lower than the previous one, and the previous one was lower than the one before that. So it's actually going in the right direction.
Okay.
The new vaccines are going to be effective, but what we've got already is preventing serious disease hospitalisation.
I did want to ask you about that. So the 2 new vaccines, do you think they're not necessary then if the current ones are doing the work?
It's just like influenza. We're always trying to keep up with the bug. We're always trying to keep up with the genetic mutations. So the reason we get a new wave is because the virus changes sufficiently to evade our immunity and to become even more transmissible than it was before. So although it's becoming more easily spread, the actual disease it causes tends to be less.
Okay.
I have to emphasise that the people at risk, the vulnerable, remain the ones who need to be vaccinated. So that's only 5% or so of the population. So the number being vaccinated in the last 6 months is more appropriate than you might think at first. People who are over 75 definitely should have a booster if they haven't had one for 6 months. And under 75, adults with serious risk factors, multiple medical problems, disabled, people with severe immunosuppression. And one other group is people who live in an institution, especially an aged care facility, where outbreaks can occur very easily.
So other than that, Robert, the elderly and those who are immunocompromised, who should be going out and getting jabbed, you're not too troubled about this latest wave?
No, I'm not. We have what's called hybrid immunity. That's a combination of vaccine-induced immunity with infection-induced. And the two together mean that we're well protected against severe disease. Yes, people are catching infection, no doubt about it, and they're spreading it. It's not nearly as infectious as things like whooping cough, which is probably going to come back soon. But COVID is still an issue for those who are at risk. And for those who become unwell, do the sensible thing and stay home until you're no longer symptomatic. But in the main, if you're at risk and haven't had a booster, then you need to be wearing those masks again in public places, on public transport, at meetings, and that Joe Biden might attend.
True. Robert Booy, always good to chat. Thanks for the update. We'll talk to you again soon.